Cindy's mom's initial meeting with Dr. Smith.
Hi, Mrs. Bush. I'm your daughter, Cindy's pediatrician. I'm more than happy to meet with you today. I have the results here from Cindy's MRI. The results of the test show that Cindy is lacking a bilateral auditory nerve. What this means is that it is more difficult for her to hear because her brain does not connect with her cochlea, the main mechanism in her inner ear, effectively, which is made evident by her missing auditory nerve. As you both were made aware of your daughter's diagnosis of Goldenhar syndrome upon her newborn screening evaluation, it was also found that she was missing a left eyelid. From the progressive corrective surgery, a new one was created for her. As you know, Cindy is still at risk for developing cataracts, glaucoma, or requiring corrective vision devices such as glasses after both of her corneas were transplanted, along with the corrective eye surgery. Does your family have any history of deafness or disorders?
Well, aside from my husband's father, who worked in an automobile factory, leading to a sensory and neural loss from all the exposure to heavy machinery, we hardly have any relations to deafness in our family. My mother, however, does have type 2 diabetes, but she was just recently diagnosed. But she regulates it with prescriptions and even insulin shots when she needs it. But mostly, she just regulates her diet from time to time, doesn't eat all those Big Macs, and it truly does help her out. But does Goldenhar syndrome typically run in families?
No. Goldenhar syndrome is an extremely rare disorder, and it's not hereditary, but it is entirely compromised of a genetic mutation. The prevalence of the syndrome is 1 in every 25 to 45,000 births, and most cases are sporadic with no apparent cause.
So if I were to try to have more children, what are the odds that they too then would have the disorder as well?
It's going to be nearly impossible. This disorder is very, very rare. Families hardly ever have 2 children with the same disorder.
So what should be our family's next step in helping Cindy's progression through these complications with her syndrome?
Well, I'm going to refer you to an audiologist and a very close friend of mine who has seen other children with Goldenhar syndrome. She is beyond wonderful and will help you develop a plan for Cindy's progression as far as educational settings, auditory modifications, and overall support for Cindy. Her name is Dr. Brooks, and I will connect you with her office right away so you can set up an appointment with her to discuss a rehabilitation plan and the possibilities of treatment by implanting an auditory brainstem.
Thank you so much, Dr. Smith. You have been most helpful. A conversation with Cindy's father, George W. Bush, via cell phone. Oh, hi, honey. I just left the doctor's office and she discussed Cindy's MRI test results and our options for her improvement. She said that from the test, they found that Cindy is missing her bilateral auditory nerve. Yes, that's a mouthful. Slow down, honey. Which means that her brain doesn't get all of the sound signals from her ears. Yes, that's why she does not readily respond to the sounds and things. But calm down. The doctor said that we have options to help correct her hearing. Oh, she told me all about her close friend. Oh, what was her name? It's Dr. something, who is an audiologist. Honey, an audiologist evaluates hearing. That is her main job. That is what they go to school for 3 more years after their regular college for. Yes, she is highly capable of evaluating our daughter. Now, we are taking her to see this audiologist, and you are coming with me. George W., I don't care what's going on at that White House. We are setting up an appointment for early next week because that was her earliest opening. So I'll need you, yes, you, Mr. Big Shot, to move things around in your schedule. Great. That sounds perfect, honey. I'll be home soon, dear. Bye-bye. George W. and Laura Bush's meeting with their audiologist, Dr. Brooks.
Hi, my name is Dr. Brooks, and Dr. Smith had referred you to my office with your daughter, Cindy, who has Goldenhar syndrome. First, I would like to talk to you about Cindy's future and the intervention I would like to take. As you already know, Goldenhar syndrome affects Cindy's auditory nerve. For this reason, I would like to suggest you to do an auditory brainstem implant. The auditory brainstem implant is very close to that of a cochlear implant, which you may have heard of before. An electrode array will be inserted and placed directly into Cindy's brain, which will allow for the connection between Cindy's cochlea and brain to establish a better hearing environment. The FDA has approved many different types of multi-channel auditory brainstem implants.
Oh, it just terrifies me thinking that our daughter will have to have surgery on her brain. George, what do you think about that?
Is this safe?
What will that entail?
Well, the surgeon will make a small incision behind Cindy's ear. They will remove a small piece of bone and then open the plane between the bone and the surface of the brain. Then they'll carefully place an electrode on the cochlear nucleus, which will allow sounds and information to be provided to the brain. The electrode will be connected by a cable to the receiver, similar to that of a cochlear implant, so it'll come down through the brain.
Has this been done before?
Yes, the FDA has recently approved it. We had our first successful child implanted in June of this year, so we're really looking forward to making more progressive moves with this implant.
Well, it sounds sort of dangerous to me. But how long after the surgery, then again, will she be able to hear?
Well, Cindy is going to have to return back to the operating room 2 months post-surgery. She has to do this so the surgeon can test and make sure the electrode arrays are stimulating the correct brainstem nuclei. Once this has been confirmed, the ABI will be turned on and we will begin to start Cindy's intense oral habilitation.
Oral habilitation? I don't know what that means.
I just don't know about all this.
Well, now when will oral habilitation? What is that? And when will Cindy actually be able to talk to us?
Well, that's what oral habilitation is. Oral habilitation is a plan that all of us are going to set together to help Cindy acquire the best language skills possible. For Cindy's case, I would recommend using an auditory verbal approach. And what this means is that we're going to start teaching Cindy about spoken language, such as English, as well as allowing her to lip read in the event that she cannot hear certain words that are said. If you do decide to go through with the ABI, I will be able to counsel you through every step of this habilitation process.
But think about it, when she starts school, how is she going to learn then? And will she have to attend school with all those other children with disabilities?
Well, it depends on what option you choose for your child. If you choose the ABI, then Cindy has a greater chance of attending a mainstream school. She will not ever have to attend a school with children with disabilities. Because of the complexities of her surgery, though, and the age that she's eligible for implantation, she's going to be about 2 to 3 years behind the learning curve in language acquisition. So, when she does begin her mainstream schools, we will have to give her an itinerant teacher. And what this means is 2 to 3 times a week, we will have a teacher pull her out to specifically focus on language development and work on those words that she may not have heard in her younger years. But around the grade, around 3rd grade, she will be completely caught up and at the same learning level as the rest of her classmates, and will be in a completely mainstream school for the rest of her school career.
Man, I don't know about you, but she's just throwing a lot on me, on us. We'll have to talk about this later, but...
Can you do it all from the beginning?
She doesn't have that kind of time, honey. Everybody else in the world stops for you, but this audiologist doesn't have to. Now, we thank you so much, Dr. Brooks, and I'm sure we will both be back to see you later on. We appreciate your time. Thank you.
You're welcome.